Hey, it's Jessica DeMassa, and that's Matthew Holt. Welcome to this episode of Health in 2.00, where we've got 2 minutes answering all of your questions about the hottest deals in health tech. And oh, there were a hell of a lot of them. Matthew Holt, it's dollars raining from the sky. What is going on? So much.
It appears to be the stock market is going back up and the money is falling from the sky and there are deals aplenty. So we'll talk about them, but there's a lot of funding going on this week. So incredible.
It's the beginning of HIMSsanity.
Next week it's HIMSsanity.
Oh my God, it's HIMSsanity now. I'm so tired. All right, are you ready? Do you have your timer set? I've got like 1 million deals we've got to get through. Ready?
Okay. Ready?
Go. Our friends at Livongo acquired myStrength. Tell me.
Did not take long. Lee Shapiro shows up. About 15 seconds later, they made their first big acquisition under his reign as the new CFO. He bought a ton of companies at Allscripts when he was there with Glenn Tillman. They bought myStrength, which is a company that raised, I think, about $10 million so far. And so they must have paid a bit more than that for it. One of the, I would say, middle-range mental health companies. Mental health is a big streaming deal because mental health impacts everything else. You can expect them to go to a bunch of other places, probably respiratory and heart failure next. They're growing fast. Armada is kind of copying them. There'll be a few of them are leading in that area.
Okay. What about Lucky Clover that raised $500 million? What's going on here?
500 million is probably sounds like a huge raise. Don't forget, Devoted Health raised 350 with the Park brothers. Clover is the other Medicare Advantage plan that's kind of a new one. You need a lot of money to plan that business. So 500 million is a hell of a lot of money to raise, but may not be that much because you're competing with United Health Group.
All right, what about Aetion that raises a $27 million round? What do they do?
Ooh, they do real-world evidence sort of data funky stuff for pharma and some health plans. They got funded by a bunch of pharma companies like UCB and Sanofi to add to Amgen, who was already in the round. Very interesting because they didn't really, I don't think they really needed that money, although their CEO, Karen McGill, does need to take me on a skiing holiday. So if she wants to spend that money, I've got some solutions for her.
HIMSS raises $100 million, not that HIMSS, the
not
other.
Not that HIMSS, this is the other HIMSS. This is one of those, this is for HIMSS. I also didn't think for hers, right? This is online telemedicine selling you, eat penile implant pills and other kind of good stuff, baldness pills, stuff I need to avoid going to the doctor. Big consumer play? Maybe.
Healthy.io, 18 million. What does this do?
Okay, this is a very interesting thing. This is kind of like the Theranos, but hopefully it works. Oh, we got nearly
so close, man. So close.
So close. Well, somebody.
But so far away.
Israeli company that does sort of, you pee on a chip. Basically, you pee on a thing, and then you.
Wait, you pee on a what?
You pee
on.
It's a urine analysis.
But what did you just say? You pee upon a what?
A stick, a chip. It's like a pregnancy test. You pee on a thing.
Okay,
and I thought you said smartphone and their app to take and it's to do with assessing kidney disease, but it's going to go to a lot of other things. And this is so camel's nose under the tent. The UK is already using it, but you're going to see a ton more of these things. In fact, I'm working with a really teeny startup called You Do It Health, which is doing You Do Test, sorry, which is that name wrong. Sorry, Alison. Which is doing a sort of similar thing to assess colon cancer colonoscopies, using poop and toilet water. You're going to see a ton of this stuff of at-home testing. We've gone past where it was just the pregnancy test at home. There's going to be a ton of this stuff coming out, and you can expect more of that. And 18 million, sounds like a lot, but to get stuff through the FDA, get it to spread in the US, they're probably going to come back and need more money.
We didn't get to Slack for healthcare.
Thank freaking God. There are enough bloody messaging, communication,
tweeting, startups,
texting, whatever companies. There's Volte with there's Sarah with the thing here, Volte with the weird pink shoes. You'll see it HIMSS next week.
No. But there's so many Slacks for healthcare.
And then Slack. I finally started using Slack because Microsoft, for like tweeting to Zoya and you and
Oh my God, I hate it.
because Microsoft has screwed Skype up so badly. They started using Skype. They started using Slack instead. But frankly, it's the same as AIM was in 1997. I mean, it's no real big.
Oh, I miss AIM.
Exactly. I mean, we could have been tweeting on, you got mail.
That was when the world was just a better, simpler place, wasn't it?
Well, I mean, so maybe, Chrissy Farr says Slack is coming into healthcare. Yeah, well, I mean, maybe they are.
I mean, but there's already so many startups whose business model is already based on being Slack for healthcare.
Yeah, not to
now
mention
that we have real Slack
not to
for
mention
healthcare.
the
It's kind of like a mind fuck right there. I don't know. So if you have a business model where you are a startup and you are Slack for healthcare and have nothing else to do, tweet us questions that we can answer on the next episode of Health 2.0. You can get me at Jess Samasa, or you can get Matthew at Bolting Boy. And our next episode is going to be a big monster preview episode of HIMSS. Not the one that just raised the $100 million round. But
the insane one.
The real one. With the cocktail parties and the happy hours and the giant exhibit hall. And I think they have sessions of some sort.
And the booth that Snack Health and WTF Health
and that booth.
And all of our friends are going to be in. What's the number?
5594, because you can never remember.
No, I can't keep on trying to guess. 5594.
5594. Okay.
Tell me often enough, I'll find the right booth where I'll be interviewing all these people, and you'll be interviewing even more.
That's right. All right. So come see us, and we'll preview the whole HIMSS experience. We'll tell you where we're going to go, what we're going to do, and who we're going to talk to next episode. So thank you so much for watching this one and sticking with us. I'm Jessica DeMassa. That's Matthew Holt. Thanks for watching Health in 2.0.